Leukemia is a cancer which attacks the white blood cells. Now what's been billed as potentially revolutionary therapy, which trains the immune system to hit back at the cancer, has shown some encouraging results. 94% of patients with an advanced form of leukemia involved in an early trial saw their symptoms disappear.
These are really remarkable results for an early phase study. So they're obviously very encouraging. We're very excited by them. We still recognize we have a long ways to go to make this even better. But certainly the initial results are very, very encouraging.
It's a potential blood cancer treatment, and this is how it worked. A blood sample is removed from the patient, and then immune cells, known as T cells, are taken from the blood. These are then modified to detect and kill cancer cells. They're then grown in the laboratory and injected back into the patient. The patients had all undergone other forms of treatment which had failed, including chemotherapy and radiotherapy, so the fact that most of them involved in the trial are now in remission is seen as an important breakthrough.
I think we've got several years before we consider this a frontline treatment, as in something that we might start with. It's worth noting that for blood cancer, standard treatment is still pretty good. 80% or so of patients respond well to standard chemotherapy and radiotherapy, and we know those work. We know what the safety concerns are. This has only been tried in patients where that has failed, and that's not very common in these patients. So a ways to go before we consider this frontline, but encouraging for the future.
There's some caution about the latest study, as the full set of data has not yet been published, but there's agreement this is an important step forward in an exciting field of medicine. Scientists say the next challenge is to get the technology, genetically engineering cells, to work on tumours as well as blood cancer. Hugh Pym, BBC News.